Why individuals need professional guidance to purchase health insurance now more than ever. Presented by Marlin McKelvy, Chartered Benefit Consultant and President of Consumer Directed Benefit Solutions.
What we're also discovering is that insurance is complicated to buy.
The individual health consumer is no longer free to purchase health insurance whenever they want. Generally, individuals can only purchase health insurance during the annual open enrollment season. The next open enrollment period is November 1st, 2015 through January 31st, 2016. Are there other times a person can buy individual health insurance? Yes, but only when they experience a change of life status event such as are listed below. What are the good features of the Affordable Care Act? First, all policies are guaranteed to be issued. No underwriting is allowed, so no medical questions have to be answered. Rates can't be adjusted for health risk, except for tobacco use. Sorry, folks. No pre-existing health condition exclusions are allowed. Pre-existing health conditions must be covered immediately. Preventive health care must be covered at 100%. Maternity coverage is now required on all health insurance policies, as are pediatric dental and vision benefits. What are some of the bad aspects of the Affordable Care Act? For the first time, an individual's health insurance status is tied to their tax status. The individual mandate penalty provision of the Affordable Care Act requires individuals to have acceptable health insurance or be subject to an ever-increasing tax penalty. It should be noted that this tax penalty can only be assessed against a person's income tax refund. Where should I purchase my health insurance? The individual consumer has two ways to purchase health insurance. The traditional open marketplace, where coverage is purchased directly from a health insurance company, generally through a health insurance agent or broker, or the new government health insurance marketplaces, where coverage from a health insurance company is purchased via a state or federal website, either directly by the consumer or with the assistance of an insurance agent or broker, or a non-licensed assistant called a navigator. By law, all health insurance plans fall into one of four categories referred to as metallic plans. These are bronze, silver, gold, or platinum plans that generally translate into coverage levels of 60, 70, 80, or 90%. What are some of the ugly aspects of the Affordable Care Act? Health insurance rates have increased significantly. Another ugly aspect of the Affordable Care Act is that many previously insured people are finding their new plans provide them with less coverage, and many newly insured people are finding themselves with more financial exposure than they had anticipated. Why should I buy health insurance through a government marketplace? Really, there's only one good reason to buy your health insurance through a government marketplace, and that is how you answer the following question. Will I or my family be eligible for a meaningful subsidy of our health insurance premium and possibly for cost-sharing reductions? What you should know about premium subsidies and cost-sharing subsidies. Premium and cost-sharing subsidies are available only for health insurance purchased through a government health insurance marketplace. A premium subsidy pays some or possibly all of your monthly health insurance premium. A cost-sharing subsidy reduces or possibly eliminates the plan's deductibles, co-payments, and out-of-pocket maximum financial exposure on the health insurance plan you select. It is important to note that this subsidy is available only for silver coverage level plans. What you should know about government marketplace insurance premium tax credits. Do I qualify for a premium tax credit? Annual incomes between 100 and 400% of the federal poverty level qualify for premium tax credits. In 2015, individuals earning between $11,670 and $46,680 qualified. Once your tax credit amount has been established, this dollar amount can be used to buy any bronze, silver, gold, or platinum level plan. As premium tax credit amounts depend upon earnings, lower income persons generally get higher premium tax credits. However, after certain income levels are passed, subsidy amounts can drop sharply and may cease to be an incentive to enroll in marketplace coverage when other trade-offs are considered. You have the option of taking your tax credit on a monthly basis where it is applied against your monthly insurance premium, or you can wait until you do your taxes and capture the entire credit at that time. Can the government health insurance marketplaces yield unexpected results? Simply, yes. While greatly improved since its rocky rollout for 2014, the healthcare.gov website is still prone to problems. Ironically, privately developed web enrollment systems that connect to healthcare.gov perform better. Another aspect that the consumer should be aware of in the health insurance marketplaces is that they enroll people not only in private health insurance, but in public health plans. For example, I recently enrolled a 25-year-old man and his family making $27,000 annually and found that only he qualified for subsidized private health insurance while his pregnant wife was forced into Medicaid and his two children were forced into the Children's Health Insurance Plan. He was not allowed to keep his family under one private health insurance option. Another important difference for the consumer to keep in mind is that the new governmental marketplaces force purchasers to also consider geography when making their decisions. Each state is divided into service areas. Insurance rates can vary in each service area, and insurance carriers can choose to operate in only certain service areas. Therefore, a buyer's choices and cost may depend upon which side of the county line they live. This is an important consideration for people with children away at college or who are divorced or separated and legally responsible for insuring their children. All health insurance is pretty much the same now, isn't it? No. While the Affordable Care Act requires that all individual health insurance plans cover certain minimum essential benefits and meet the requirements described earlier, the insurance companies were left to design plans to meet these requirements. This has resulted in wildly different solutions from each insurance carrier that makes health plan selection more complicated than ever before. What differences should an informed consumer be aware of? Do not assume health insurance plans sold in the government marketplace are the same as those sold in the open marketplace. Quite simply, government marketplace enrollees are sicker and more expensive to serve. Insurance companies have to take steps to manage this new risk they are forced to assume. Insurance companies manage this risk through reducing the sizes and scope of their provider networks and restricting member access to expensive medications and nationally known centers of excellence. Are the doctors you want to use participating in the health insurer's network? Are the hospitals you want to use participating in the health insurer's network? Be specific. Don't assume each hospital in a hospital system is an in-network provider for the health plan you are considering. Are the pharmacies you want to use participating in the health insurer's network? Smaller pharmacy networks are becoming a common plan design feature. Are the specific prescriptions you are taking covered by the health plan you are considering? If so, at what level are they covered? Would you have to try other medications, even ones you tried in the past and found ineffective before your current medication would be approved? Is the prescription you are taking subject to the health plan's major medical deductible or a separate prescription drug deductible before it is financially covered? Does the health plan you are considering cover services from non-network providers? Not all do anymore. Does the health plan require that you get a referral from your primary care physician before you can see a specialist? Some do. Just because the health plan you are considering indicates it provides coverage for non-network providers, how extensive is that coverage? Will it cover care at institutions such as the Mayo Clinic or MD Anderson? Congratulations! You now know more about the Affordable Care Act than many of the lawmakers who passed it. And yet, there's even more an informed buyer should know before they purchase individual health insurance, and that is why people need the help of an experienced, knowledgeable insurance professional, such as Consumer Directed Benefit Solutions. Thank you.